better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started. Hi, everybody. Welcome back. I'm Dr. Meggie Graham. Today, I want to talk to you about something that I've been thinking about nonstop. So I figured if I'm thinking about it nonstop, let's talk about it. Yesterday, I was finishing a yoga class with a dear friend of mine, and we were chatting afterwards and just catching up. And she congratulated me on selling my restorative dental practice, and she asked me what I was up to, and I told her I was really excited about things that were happening with Untethered. I told her about our podcast, that my focus right now is teaching providers about recognizing airway dysfunction in their patients and teaching them how to treat it in their own practice. Talked about our new frenectomy course that just launched. And this mom this fellow yogi was next to us, and she interjected and she said, "I'm so sorry to interrupt, but I heard you say Untethered, and I was actually referred to your practice when my baby was born, but I never ended up coming to see you because I didn't think there was actually a problem. In fact, it made me really upset because I was told that the baby had a tongue tie, but we weren't struggling to nurse. At least I didn't have any overt problems. The baby was gaining weight. I didn't have any pain. So, I just didn't come in to see you." And, we carried on with the conversation, niceties, Happy New Year, goodbye. And I kept on thinking about that because why would you come to see us if you're not having any problems? We don't want to create problems that don't exist. I say that all the time. That's definitely not our MO. It's not ethical. We are here to help relieve problems. But I also think information is super powerful. And I think there's a lot of confusion about tongue ties, the world of tethered oral tissues, being underdiagnosed, overdiagnosed, when to treat, when not to treat. And so I thought I would just spend some time breaking this down. So the mom's reaction to not come in makes complete sense to me. When you're holding a newborn who is nursing and growing and doing well, it feels protective to trust what you can see right in front of you. It doesn't feel logical to go looking for a future issue when everything appears to be okay right now. So rather than framing this as right or wrong, I really want to explain what's actually happening inside a baby's body when there's a tongue restriction and feeding is still going well. This is the part that's almost never explained clearly, and without it, conversations about tongue ties or lip ties or oral restrictions can feel really confusing. They can feel controversial. And so let's start with how the baby's designed to nurse. In an ideal situation, a tongue lifts, it elevates, it extends forward, and it cups the breast during nursing. The tongue moves in a smooth wave-like motion that can help draw milk out of the breast efficiently. The jaw opens and closes gently. The lips stay relaxed. You might hear us say flanged, where they're flanged out, not curled or pursed under. The neck and the shoulders remain soft, and feeding is coordinated and relatively low effort for both mom and baby. So let's talk about what happens or what changes when the tongue can't move freely. When a baby has a tongue tie or a lip tie, for this conversation, let's say tongue tie, just to stay consistent, and the tongue can't elevate well, or it can't extend all the way, or doesn't move as an individual unit but incorporates the floor of the mouth muscles, the baby still needs to eat, and so the body does what a body's going to do. It adapts. The human body is so incredible in its ability to make adaptations and compensate. Instead of the tongue doing most of the work, other parts of the body step in. The lower jawbone starts to chomp, or the lips will kind of grip on more firmly. The cheeks may engage more than they're designed to. The floor of the mouth will tighten, which shifts down into a tight neck and upper body. And from the outside, feeding can still look okay. It can look effective. Milk transfer is happening. Weight gain is happening. But if those compensations are happening right from the beginning, right from the get-go, this altered muscle pattern is setting that baby up to have a different growth trajectory. And this is where I want to talk about this today. So because of this internally changed muscle use pattern, it's important because muscles guide how bone grows. And when feeding relies more on compensations like clenching of the lips and cheeks and less on the tongue elevation, the forces acting on the facial bone growth start to shift. The tongue is no longer providing constant, gentle pressure to the roof of the mouth, and that gentle, consistent pressure of the tongue on the roof of the mouth is what grows the entire midface wide and forward. Without it, the palate or the roof of the mouth grows higher and narrow and vaulted, and that is the nasal cavity. So you have an oral cavity, small mouth, and you have a small nasal cavity, and so that influences airflow. And then other muscles are being overworked and becoming more dominant, and the other muscles remain underused. So there's a complete misbalance of the muscles being used. And these patterns don't just fade or go away, they become the default of how the body functions. This dysfunction becomes that child's norm. And as the baby grows into a child, those early compensations influence not just nursing, but how they swallow, how they breathe, how they actually hold their jaw at rest, how they transition to eating solid foods, how they start to articulate words and speak. And even when they're just at rest, it influences how their tongue rests. We want our tongue to be resting in its entirety at the roof of the mouth, not at the floor of the mouth. And if the tongue is restricted in mobility, it's going to sit low on the floor of the mouth. Resting tongue posture matters just as much as muscle function. If the tongue rests in the floor of the mouth rather than on the roof of the mouth or the palate, the stimulus for that proper forward, wide facial growth is reduced continuously. So what happens if a tongue tie goes undiagnosed or untreated? Well, if the dysfunction is occurring and other muscles are being used, the facial development will be different. And often what we see is a narrow vertical growth of the face rather than wide and forward, which leads to trouble breathing through the nose. It can lead to crowding of the teeth. It can lead to more complicated orthodontic treatment because the bone to house the teeth is not sufficient. It can impact how a child breathes, so that will impact how the child sleeps. They might snore, they might clench and grind their teeth, it might be restless sleep, and that can lead to behavioral issues, focus issues, anxiety issues, and that can impact the personality or behavior. A child might struggle with focus, they might have emotional regulation issues or daytime sleepiness, and these challenges are often attributed to personality or behavior, but they can be this downstream effect of poor sleep quality and inefficient breathing that is actually because of unfavorable facial growth and not having enough space to breathe. And that comes from the restriction in the oral cavity or the tongue that's not able to move starting in utero. So the key point is this: the outcomes are not random, they're not just sudden. They develop slowly from patterns that begin very early in life. And this is why feeding alone in infancy can't be the only measure we use to assess function. Feeding tells us whether a baby can survive. It doesn't tell us whether the system is developing optimally. I want to be very clear about something really important. This entire conversation is not meant to be alarmist. We don't want to cause fear in parents. It's not meant to suggest that every baby with a tongue tie will develop severe problems. It's meant to explain how the body adapts and how those adaptations influence growth in sometimes subtle but meaningful ways. When families are given this context early, they're empowered. They can observe growth intentionally. They can watch for signs that things are going off track, and they can make decisions of when and if they want to intervene. They can recognize changes in sleep and breathing. They can keep an eye on feeding patterns as the kiddo gets bigger, and they can seek support earlier when options are often simpler and less invasive. That's what empowerment looks like. It means understanding how development is supposed to work. It means knowing what signs to watch for. It means having choices. It does not mean that action is required immediately. And it certainly doesn't mean that you have to do a procedure in infancy. But it means families are no longer in the dark. Many families choose observation during infancy, and that can be an appropriate decision when it's made with understanding rather than dismissal. What's really hard for me to see in the stories that I hear about is when families are told that everything is fine or something's not a big deal, and there's no explanation, and later they feel blindsided by challenges that seem disconnected from those early months. So, I wish I would have known that, or nobody told me, is what we hear all the time. So having that awareness, again, is not to create a problem that doesn't exist. It's to allow parents to know what could happen so they can watch for symptoms that might warrant treatment. So when a parent says, I wish I had known, it's not regret that they didn't have a procedure. It's regret that they didn't have the missing information. And that's where we're so passionate about spreading this awareness, because there is so much confusion about it. This conversation is to help prevent that. It's helping to allow families to understand what could happen if the tongue tie is not addressed in infancy. All of our work at Untethered is not about creating problems. It's about explaining development. It's about acknowledging that the body is incredibly good at adapting and compensating, and that those adaptations will change something, and it's often the shape of the face. If you're a parent listening and you were told that your baby had a tongue tie, but everything seemed fine, you did nothing wrong. You trusted what you could see, and that makes sense. And if you're hearing this now and thinking, I wish somebody had explained it this way earlier, that feeling is really valid too. The goal is not fear, the goal is clarity, so decisions can be made intentionally from the very beginning. Before I close, I want to be clear about what comes next, depending on who you are listening to this as. If you're a dentist, this is an invitation to deepen your understanding rather than rely on surface level screening or incomplete explanations. Diagnosing and treating tethered oral tissues requires understanding of not only structure, but function, growth, neuromuscular patterns, airway implications, and timing. That is exactly why we created our surgical frenectomy course. It's designed to help clinicians understand what they're seeing, why it matters, and how to treat it thoughtfully and responsibly with long-term outcomes in mind. And if you're a parent, our goal has never been to push treatment. We've created our website as an educational resource so that families can learn and make informed decisions without fear or pressure. You deserve access to clear information about how your child is designed to develop and what options exist if support is ever needed. And if this episode resonated with you, whether you're a provider, a parent, or someone who wishes they had heard this information earlier, I ask you to help us spread this message. So subscribe to our podcast, like this episode, and share it with someone who might benefit from hearing it. This work is not about creating problems, it's about creating clarity, and clarity shared early has the power to change lives. Thanks for joining me today and listening to me work through my thoughts. Join us next time.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this, and don't forget to subscribe.
want to learn more about Airway Health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye!